If you have ever wondered how an upper eyelid blepharoplasty can be uniquely crafted to you, watch this video to look at the adjuncts that can be used during blepharoplasty surgery to make sure that you are as happy as possible with your results. My name's Ahmed Aziz and I'm an oculoplastic surgeon here in London. Now let's dive in. So understanding your unique facial structure is key, and also trying to know what you want is also incredibly important. That's why, particularly in our clinic, we do 3D reconstructions after listening to what your desires are to see what's achievable and what you are wanting, and if we can marry those two together. One of the most simple things that you can do is determine how much skin to remove. So some people want the maximum amount of skin to be removed. Some people want a bit of overhang left over from their upper eyelid blepharoplasty. Some people want really minimal approaches, and it's important to discuss these with your surgeon so that they know what you want and how can have that discussion with you to try and achieve what you are looking for. Another important thing to talk about is muscle and fat removal. Now, in most people, we tend not to remove muscle and fat for obvious reasons. As we get older, we lose volume in our upper eyelids. And if you are then going for blepharoplasty surgery and removing muscle and fat, you are then removing volume. And later down the line, following your surgery, you can have this hollowed out or aged appearance. So although a lot of surgeons were typically initially trained to remove muscle and fat routinely in their upper eyelid blepharoplasty, it's on a case-by-case basis. If the eyelids are incredibly full and heavy, then maybe it's a good idea. But if there isn't that much volume there, then maybe we avoid removing muscle and fat to try and give you the best result possible. Another thing to look at are the medial fat bags. So you might find some older people having some fat coming forward just by the sides of their noses on the upper eyelids, and it just comes forward and it looks very aging. Classically, we used to remove the fat from those areas, but increasingly what we're doing now is we're taking that fat and repositioning it across the eyelid to the outer eyelid. Why? Because then that gives a natural looking fullness to the outer eyelid. And one of the youthful appearances of an upper eyelid are to have fullness on the outer eyelid. As we age, we get a reduction in fullness in the outer eyelid and a relative increase on the inner eyelid. And so to restore that back in that way is always a nice result if possible. Part of making the outer upper eyelid fuller is the brassiere suture, and what that does is it's a suture from the orbicularis muscle, which is the muscle under the skin in the upper eyelid, to the brim to try and support the brow fat to naturally give a fullness to the outer brow. This is also quite a nice subtle look to try and give that fullness there and give a more youthful and a more cosmetic appearance. Another thing that people do consider is the browpexy. Now, typically when we have upper eyelid skin that's excessive, we raise our brows without even realizing to try and get that skin out of the way. And when we do the upper eyelid blepharoplasty, what ends up happening is that excess skin is gone and the brows can drop. The browpexy tends to give a bit of support, but it's not the same as a brow lift. Typically, you're getting 2 millimeters of lift on the outer brow, and it's a subtle way to try and support that brow if required. The closed canthopexy is also another thing that can be done with an upper eyelid blepharoplasty. Some people like a subtle outer upturn to the eyelids and think that's a more attractive look, and that can be done at the same time as the upper eyelid blepharoplasty without an additional incision. It's done through the upper eyelid blepharoplasty, and it gives just that subtle lift to the outer angle of the eye that some people do find desirable. It's only, again, 2 millimeters. It's still a very natural, very subtle look, and it's not excessive like you see in some other adverts that are advertised on the internet. So to summarize, it's important to consult with your surgeon, be really open and honest, and talk about your specific needs and desires so that they can tailor their upper blepharoplasty to you. Once your surgeon knows what you're looking for, they can develop a plan with you to make you feel good about yourself and confident in your skin and with your face. Remember, upper eyelid blepharoplasty isn't just about removing excess upper eyelid skin. It's about enhancing your expression, looking at what you're wanting and trying to make sure that that upper eyelid surgery is absolutely right for you.